Pre-implantation genetic testing, PGT, techniques and applications, PGT-A, PGT-M, PGT-SR. Pre-implantation genetic testing, PGT, refers to a set of techniques used to analyze embryos for genetic conditions before they are transferred into the uterus during an in vitro fertilization, AVF, cycle. PGT allows for the selection of embryos that are free of certain genetic disorders or abnormalities, thus improving the chances of a successful pregnancy and reducing the risk of inheriting specific genetic diseases. There are three primary types of PGT: PGT-A, PGT-M, and PGT-SR. Each type has distinct applications and techniques depending on the genetic issues being addressed. 1. PGT-A, pre-implantation genetic testing for aneuploidy. A. What is PGT-A? PGT-A, formerly known as PGD or PGS, is used to screen embryos for chromosomal abnormalities, specifically aneuploidy, where there is an abnormal number of chromosomes in the embryo. Aneuploidy is a common cause of miscarriage and implantation failure in IVF cycles. Common chromosomal abnormalities include conditions like Down syndrome, trisomy 21, Edwards syndrome, trisomy 18, and Patau syndrome, trisomy 13. PGT-A aims to identify and select embryos that have the correct number of chromosomes, euploid embryos, for transfer, increasing the likelihood of a healthy pregnancy. B. Techniques used in PGT-A. Blastocyst biopsy. Typically, cells are biopsied from the trophectoderm, the outer layer of cells of the embryo, typically on day 5 or day 6 of embryo development. The biopsy involves removing a small number of cells, typically 5 to 10 cells, without damaging the embryo. Genetic testing is then performed on these cells to identify chromosomal abnormalities. C. Applications of PGT-A. Reducing miscarriage rates. By selecting embryos with the correct number of chromosomes, PGT-A helps reduce the risk of miscarriage, particularly in women over 35, where aneuploidy rates are higher. Increasing implantation success. Identifying healthy embryos for transfer increases the chances of successful implantation and live birth. Advanced maternal age. It is particularly beneficial for women over 35, as they have an increased risk of chromosomal abnormalities in their eggs. D. Benefits and limitations of PGT-A. Benefits: improved pregnancy outcomes. Selection of healthy embryos increases chances of live birth and reduces miscarriage rates. Increased success rates for IVF. By selecting the best embryos, IVF cycles have a higher chance of success. Limitations: embryo loss during biopsy. Although rare, biopsying embryos may damage them, reducing the number of embryos available for transfer. Cost: PGT-A adds additional cost to the IVF process. 2. PGT-M, pre-implantation genetic testing for monogenic disorders. A. What is PGT-M? PGT-M, also known as PGD or pre-implantation genetic diagnosis, is used to test embryos for monogenic disorders, single gene disorders. These are inherited diseases caused by mutations in a single gene, such as cystic fibrosis, sickle cell anemia, Tay-Sachs disease, and Huntington's disease. PGT-M is performed when one or both parents are known carriers of a genetic disorder or have a family history of a specific condition. B. Techniques used in PGTM, single cell biopsy. A single cell is removed from the embryo, typically from the blastomere, on day 3, though blastocyst biopsy can also be performed. The DNA from the cell is analyzed for the presence of the genetic mutation causing the disease in question. PCR, polymerase chain reaction, and next-generation sequencing, NGS, are commonly used to analyze the genetic material for specific mutations. C. Applications of PGTM. Preventing inherited diseases. PGTM enables the selection of embryos that do not carry the genetic mutation for a specific monogenic disorder, reducing the risk of the child inheriting the disease. Family planning. For families with a known genetic mutation, PGTM provides an opportunity to have children free of specific inherited diseases. D. Benefits and limitations of PGTM. Benefits: prevention of genetic diseases. By selecting embryos that are not affected by the inherited disease, PGTM ensures that the offspring do not inherit serious monogenic disorders. Increased quality of life. This technique offers families affected by genetic diseases the chance to have healthy children. Limitations: cost and complexity. The process is more complex and expensive as it requires in-depth genetic analysis. Availability: not all genetic conditions are amenable to PGTM, and it requires specific genetic counseling and testing. 3-PGTSR, pre-implantation genetic testing for structural rearrangements. A. What is PGTSR? PGTSR is used to test embryos for structural chromosomal rearrangements such as translocations, inversions, and deletions. These rearrangements can cause infertility, miscarriage, or birth defects. PGTSR is particularly helpful for individuals or couples who have a known balanced translocation where a portion of a chromosome is rearranged but not lost and are at risk of passing unbalanced chromosomal rearrangements to their offspring. B. Techniques used in PGTSR. Blastocyst biopsy. Similar to PGTA, a small sample of cells is taken from the embryo for genetic analysis. The sample is analyzed to determine if the chromosomal rearrangements present in the parents have been passed to the embryo, ensuring that only embryos without unbalanced chromosomal arrangements are selected for transfer. C. Applications of PGTSR. Preventing miscarriage. Individuals with chromosomal rearrangements are more likely to experience recurrent miscarriage. PGTSR helps identify embryos without unbalanced chromosomal rearrangements, increasing the likelihood of a successful pregnancy. Fertility preservation. Couples with known chromosomal rearrangements can use PGTSR to select the best embryos for transfer, avoiding the risk of producing embryos with unbalanced genetic material that may result in severe genetic disorders. D. Benefits and limitations of PGTSR. Benefits: improved pregnancy outcomes. By selecting embryos free from unbalanced structural rearrangements, the risk of miscarriage or birth defects is reduced. Fertility preservation. PGTSR helps preserve fertility for couples with chromosomal issues, enabling them to have healthy offspring. Limitations. Complexity. PGTSR can be more complex than other forms of PGT due to the need for specialized testing of chromosomal structural issues. Not applicable to all patients. This test is only available for couples with known chromosomal rearrangements. 4. Conclusion. Pre-implantation genetic testing, PGT, has revolutionized reproductive medicine by enabling the selection of genetically healthy embryos before implantation, improving IVF outcomes, and reducing the risk of passing on genetic disorders. The three main types of PGT, PGTA for aneuploidy, PGTM for monogenic disorders, and PGTSR for structural rearrangements, each address specific genetic concerns and are invaluable tools for families affected by genetic conditions or seeking to maximize IVF success.